Hello friends, let's discuss the questions of quiz 2 round 1. First question was about the apex of suprapleural membrane. So the attachment of the suprapleural membrane was asked. Let us see the options. The transverse process of T1, transverse process of C1, body of T1 and body of C7 vertebra. We know that suprapleural membrane, it is a membrane which covers the inlet of the thorax and it is attached in the inner border of the first rib. The base is attached to the inner border of the first rib, whereas the apex is attached to the transverse process of C7 vertebra. So the correct answer was the transverse process of C7 vertebra. Next question, it is about the crus of the diaphragm and the medial and lateral and the median arcuate ligament. So thickened upper margin of psoas sheath is, let us see the options. The options were median arcuate ligament, medial arcuate ligament and lateral arcuate ligament. So the correct answer for this question was median arcuate ligament. So it is the upper margin of sheath of the psoas major muscle, whereas the lateral arcuate ligament, it is the upper margin of sheath of quadratus lumborum muscle. Correct answer was medial arcuate ligament. Next question was about the openings in the diaphragm, very important topic. Structures passing through the aortic opening are all except. We know that the structures passing through the aortic opening are descending aorta, Hirschheimer's vein and thoracic duct. If we want to discuss these structures from right to left, then it will be Hirschheimer's vein, thoracic duct and then descending thoracic aorta. So the option that has to be excluded, it was left gastric artery. The exception was asked. Let us see the options. So what were the options of this question? Aorta, Hirschheimer's vein, thoracic duct. And exception is left gastric artery. Passes along with the esophagus, isn't it? Next question, again it was based on the openings in the hernia. Bogdale's hernia, it is a posterolateral hernia. Bogdale's hernia is a posterolateral hernia. Let us see the options. So there is a option of retrosternal hernia, posterolateral and retroesophageal hernia and central hernia. The Bogdale's hernia is posterolateral. Anteriorly there is space of Larry through which the retrosternal hernia sometimes occur, and retroesophageal hernia, it is the sliding hernia or the rolling hiatus hernia, it may occur. Next question is about first controsternal joint. The classification of the joints of the thorax is really important. First controsternal joint is which type of joint? Let us see the options. Options were saddle primary cartilaginous, plain synovial and secondary cartilaginous. So the correct answer, it is primary cartilaginous joint. Pectus excavatum, funnel chest and pectus carinatum. It is also called as pigeon chest. Unfortunately, this was a typographical error in the quiz. Both the options were shown as the same answer, sternum pushed backwards. And again, the next option was sternum pushed backwards. I'm really sorry for this typographical error. The answer is sternum pushed backwards. It is pectus excavatum, isn't it? And pigeon chest or the keel chest, it is the sternum pushed forwards. Next question was about the suprasternal notch and its vertebral level. All of us know the structures in the suprasternal notch, but what is the vertebral level of the suprasternal notch? Let us see the options: T2, T4, and C7. So T4 we can easily exclude because we know at the level of T4 there is sternal angle, isn't it? So in between C7 and T2, the suprasternal notch, it lies at the level of T2. If you revise the boundaries of the inlet of the thorax. The vertebra shown in the image, it has been shown that this vertebra, it has a upper demifacet only, lower demifacet is absent. So obviously there will be a circular facet in the vertebra which is lower to this vertebra. So we know that 10th, 11th and 12th vertebra, they carry a rounded facet on their body. So this is T9 vertebra which is shown in the image. So options were T1, T9, T10 and T11. Why not T1? Because T1 it will again have a round or circular facet on the upper part and a demi facet for the second rib, articulation of second rib in the lower part, and also the spine of the T1, it will be horizontal similar to the C7 vertebra. So correct answer for this question is T9. The muscle which is replaced anteriorly by the anterior intercostal membrane. This is a very basic question. External intercostal muscle is replaced anteriorly by anterior intercostal membrane, whereas the internal intercostal muscle is replaced posteriorly by posterior intercostal membrane. Typical intercostal spaces. The spaces are described or classified as typical and atypical intercostal spaces. Typical intercostal spaces which have the intercostal nerve supplying for the space only. So such typical intercostal spaces are third, fourth, fifth and sixth. First and second as well as 7 to 11, these are supplying other areas. First and 2 are supplying to the R, whereas 7 to 11th, these are supplying to the anterior abdominal wall in addition to the intercostal space. That is why the correct option was third to sixth intercostal spaces. These are typical intercostal spaces. Next question is about the posterior intercostal arteries. First and second posterior intercostal arteries are branches of. This is a very important question. These are branches of superior intercostal artery, which is a branch of subclavian, isn't it? Next question was about the true and false question. The second, third, and fourth veins, they join to form the right superior intercostal vein, which in turn drain into the azygous vein, whereas second, third, and fourth intercostal vein join to form left superior intercostal vein, which in turn drains into the left brachiocephalic vein. So this is the draining pattern of the intercostal posterior intercostal veins on right and left side, and both the statements are true. Now next question was about the diameters of the thoracic cavity. So we are having a vertical diameter, transverse diameter and anteroposterior diameter. We know that The vertical diameter, it is changed due to the contraction of the diaphragm during inspiration, whereas the bucket handle movement, it increases the transverse diameter, and the pump handle movement, it increases anteroposterior diameter of the thoracic wall. Correct answer was contraction of the diaphragm during inspiration. True statement about parietal pleura. The parietal pleura, it is a pain sensitive pleura. It is supplied by the nerves, somatic nerves, isn't it? So let us see the options. It develops from splanchno-pleuric mesoderm. So correct statement is it develops from the somatopleuric mesoderm. The parietal pleura is pain sensitive. This is a true statement. The parietal pleura, it does not line the fissures of the lung. The visceral pleura, it lines the fissures of the lung, and it is supplied by not by the splanchnic vessels, that is bronchial vessels. These are not supplying the parietal pleura, but the branches from the intercostal arteries, they are supplying the parietal pleura. That is why the true statement amongst these, it is the parietal pleura, it is sensitive to pain. Structures related to mediastinal surface of both the lungs. Let us see the options. Aorta, it is related to the left lung. Esophagus, it is related to both the lungs, esophagus. And esophagus vein, it is related to the right lung. So the correct option is esophagus. Now again, this is a true and false type of question. Right lung is shorter and broader. Left lung is longer and narrower. Right lung is shorter and broader, whereas left lung is longer and narrower. So both this statement, these are true, isn't it? Vagus nerve, it supplies lung, and stimulation of vagus nerve, it leads to. So the vagus nerve, it is, if you have revised the central nervous system general anatomy, then vagus nerve, it is a parasympathetic nerve. So you might have heard of thoracolumbar outflow, that is a sympathetic outflow, and parasympathetic outflow is craniosacral outflow. So craniosacral, the cranial nerve, vagus nerve, it is a parasympathetic nerve, one of the parasympathetic nerves, and it supplies the smooth muscle of the bronchus, and it will cause bronchospasm. It will cause bronchospasm. That is why sympathomimetic drugs, that is the drugs resembling the sympathetic system in their action, they are used to relieve the bronchospasm which occurs in asthma. So these sympathomimetic drugs, they will bring about bronchodilation. Which of the following is correct sequence in respiratory passages? So this is a common question. So correct answer is alveolar ducts, then we have atria, then air sacules, and finally there are alveoli. So correct sequence is alveolar duct, atria, air sacules, and alveoli. Bronchopulmonary segment is not a bronchovascular segment. So is this a true or false statement? We know that bronchopulmonary segment is not a bronchovascular segment because though they have their own artery, the vein is in intersegmental in nature. The pulmonary venules, these are intersegmental in nature, whereas the pulmonary artery, it is segmental in nature. So this is a true statement. Permanent dilation of bronchi and bronchioles due to chronic infection is called, this is a clinical anatomy question. This condition is called as bronchiectasis. The condition is called as bronchiectasis. Now, again, there is a true and false type of question about bronchopulmonary segments. This is again applied anatomy of bronchopulmonary segment. Tuberculosis of lung is restricted by bronchopulmonary segments because of their segmental nature. And statement B, it is bronchogenic carcinoma. It spreads from one segment to another. So here statement A is a false statement because the tuberculosis also it does not follow the segmental nature of the lung. It can affect any of the segment. So tuberculosis and bronchogenic carcinoma both they are able to spread from one segment to another. So here in this question statement A is a false statement whereas statement B is a true statement. There is more dead space on the left side. So in superior mediastinum, there are arteries on the left side, whereas veins on the right side. And veins, this is a false statement. Pericardial cavity is present between. We know that pericardial cavity it is having two layers. One is fibrous and another is serous layer. And the serous it is having further two layers, parietal and visceral, out of which parietal and visceral. So pericardial cavity is present in between the parietal and visceral layers of serous pericardium. True ribs. So this is again a very basic question. Which ribs are called true ribs? So there are various classification of the ribs. True ribs, false ribs. Then we have vertebrosternal, vertebrochondral and vertebral ribs. Then we have typical and atypical ribs. Out of these true ribs, which are articulated directly with the sternum. So 1 to 7, these are called as true ribs. Structures related to the neck of first rib are all except. So structures related to the neck of first rib are all except. We know the structures. The structures are sympathetic chain. Then we have first posterior intercostal vein, superior intercostal artery, and T1, first thoracic nerve. So superior intercostal vein is not an option. First posterior intercostal vein is the correct option. So we have to exclude the superior intercostal vein. All of the following muscles are attached to first rib except the first rib provides attachment to subclavius muscle. It provides attachment to scalenus anterior and scalenus medius muscle. The serratus posterior, however, it is attached to the second rib. So we have to exclude serratus posterior. Point of interventricular, interatrial and atrioventricular sulcus of heart is called crux of the heart. We know that the meeting point of interatrial, interventricular and atrioventricular sulcus is called as crux of the heart. Now next question was about the interior of the right atrium. So Thebasian veins, the small vena cordis minimi, these are referred as Thebasian veins, whereas the Thebasian valve, it is the valve of coronary sinus. So the option A or statement A in the question, it is a false statement. So A is false and B is true. Superficial vein connecting lateral thoracic vein with the superficial epigastric vein, it is called as you can see in the question, it is called as thoracoepigastric. So the name is thoracoepigastric vein. Notching of the rib is suggestive of. So notching of the rib, it is seen in the coarctation of aorta, where there is a decrease in the blood flow from the aorta, and to compensate for this, the posterior intercostal arteries, they become enlarged and they will produce characteristic notching of the rib. Bronchial constriction of esophagus is due to, so obviously bronchial constriction, it will be due to the bronchus, but left or right, we have to choose in between. So left bronchus, it will produce a constriction on the esophagus. Correct answer is left principal bronchus. It is producing the bronchial constriction of the esophagus. And that is all for the discussion of the quiz 2 round 1. Thank you very much for patient listening. See you.